Hi, everybody. Welcome back for another episode of Eye Health Conversations with Dr. Okogbaa. I am Dr. Okogbaa, so welcome. We've been talking about glaucoma, and I'd like to. We talked about what glaucoma is. We said it was a condition or eye disease that actually causes damage to the eyes, and it in the specific structure it tends to damage is the nerve, and we cannot see our nerve just by looking in the mirror. The optic nerve, it connects our eyeball to our brain to send information from our eyes back to the brain. Okay. And so when that gets damaged, it can cause blindness. And so we call glaucoma a silent thief. Silent. Why is it silent? Because a lot of times when we have glaucoma, you don't know it, okay, until it's in the late or very advanced stages. That's when the symptoms uh, shows up. All right. And so I'd like to talk about how who's at risk. So just know that there's an estimated 3 million people in the US who have glaucoma. However, only about half of the 3 million know that they have this condition, and it's slowly taking away their sight. And so, glaucoma is a very significant condition to take very seriously. It is the most common cause of blindness in people of color. If you are African American or of African ancestry, it is the number one cause of blindness. And so it's a very, very important condition to know about, and therefore for you to take action um, to protect your eyes. Okay, so let's continue with who gets this, right? So, who's at risk? So, age many times is always a factor, right, for conditions. And so, the older you get, over 40, your risk goes up a little bit. If you're African American, your risk significantly increases. If you have family history of glaucoma, your father, mother had glaucoma, siblings, aunt, uncles. So when you go to eye doctor, those are some of the questions we will ask you about your family history, because knowing the family history tells us, oh yeah, you are at risk. So we need to make sure that we find out all the risks, and that helps us to navigate and know how to manage this condition. Um, who else is at risk? Well, if the pressure in your eye is high, you're definitely at risk for glaucoma, for developing glaucoma. Okay. If you've had any previous eye injuries, that also put you at risk for glaucoma. Long-term use of steroids also causes can cause glaucoma in later on. The other thing is other conditions can actually impact you as well with glaucoma. So things like poor um, circulation, and the most common one, diabetes, believe it or not. Diabetic, if the diabetes is uncontrolled, it doubles the risk of getting the glaucoma. And so those are some of the things that can impact the eyes. Now, my next question I tend to get is, well, how do I know I have glaucoma? What are some of the signs or things I experience that will tell me that I have this condition? Well, many times early on in this condition, in the process, you do not know it at all. Okay, you do not know it until it's too late, or amount of the vision away. That's why we call it a silent thief. And so many times the biggest thing will be when it's in its advanced stage, it will cause just blurry vision, but mostly spots more in your peripheral or your side vision, because glaucoma tend to impact the side vision. Now I'm talking about the most common type of glaucoma, which is open angle glaucoma. Now, if you have something like closed angle glaucoma, where and some people have that type of structure of their eyes, the angle is closed, well, they can get these southern um, episodes where the pressure suddenly goes extremely high, the eye is red, very painful, and that's usually an emergency, and you got to go to the emergency room. But for the open angle glaucoma, the most common type of glaucoma, typically there's really no symptoms. So the best way to know is to really get your eyes regularly checked by your ophthalmologist, where your ophthalmologist will do a thorough exam, check your eye pressure because we want that pressure to remain at a certain level. Um, Also examine the eye. We examine the eye from front to back, looking at the angles, looking at the optic nerve, your retina, all of that. And so that's why it's very, very important to get an eye exam, because we can detect this condition early. And if we detect it early and start treatment, then your risk of blindness gets reduced significantly. Okay. And so that's why it's an important condition to know, especially if you have a family history. Ooh, my uncle had this, or my grandfather went blind, or my mother is taking eye drops. Then yeah, it's very important that you make time to get your eyes examined and checked. Okay, so that's all I had for you today. And next time we're gonna talk about, well, what are some of the tests that we do to to see what the glaucoma is doing, and how we detect glaucoma through testing in the eye doctor's office. Okay, so thank you again for joining me today. I hope you found this information helpful. Please share this video with somebody who you know may need to hear this, or would find this information useful. And if you have not had your eyes examined and you are in the Baton Rouge, Louisiana um, area, come on by. Check us out at www.lacenterforeyes.com, and we'd be happy to see you. Thank you so much and have a wonderful day. Bye.